introduce you to today's speakers. Dr. Jeffrey Dermer is a systems neuroscientist, neurologist, and sleep medicine physician. He's an adjunct professor at Georgia State University Department of Health Professions and co-founder of Fusion Health. Before starting Fusion Health, he directed the Emory University Sleep Laboratory Program. He's a 3-term member of the Medical and Scientific Advisory Board for the Restless Legs Foundation and serves as the Sleep Performance Director for the Atlanta Falcons. Dr. Dermer is also an appointed sleep medicine advisor to the Federal Aviation Administration. Dr. Dermer earned his MD PhD from the University of Pennsylvania. Our guest, Nancy Rothstein, is the Director of Circadian Corporate Sleep Programs. Known as the Sleep Ambassador, Ms. Rothstein is on a quest to raise awareness, educate, and provide strategies to optimize sleep. Besides frequent lectures and consultations with major corporations, organizations, universities, and schools on the importance of healthy sleep, she serves on the NIH Sleep Disorder Research Advisory Board and on the steering committee of myapnea.org. She is the author of My Daddy Snores, which is published by Scholastic and has sold over 400,000 copies. She earned her BA from the University of Pennsylvania and her MBA from the University of Chicago Booth School of Business. All right, Dr. Dermer, take it away.
All right, thank you, Jesse. And thank you all for joining us today on the webinar. Looks like we have an all University of Pennsylvania group today with Nancy Rothstein and myself. What we're going to talk about today, I think, is going to be very relevant to those of you that are engaged with workforces. So if you have a large workforce or even a small workforce, you're going to find that there's a lot of data out there that supports this problem and solving this problem, which is insufficient sleep. And I'm going to provide you with a little bit of a backdrop to start off with. As Jesse just talked a little bit about our introductions, we're going to walk right into the facts about sleep loss and the U.S. workforce, so as a bit of a backdrop to our conversation with Nancy. But also I'm going to talk a little bit about what happens when companies address sleep loss. And this is really what we here at Fusion Health, and also what Nancy does with her work as the sleep ambassador in large corporations. And then we'll have that conversation with the sleep ambassador, Nancy Rothstein, and we'll talk a little bit with the audience as well. Before we start, though, I'm going to drop some information on you. So the very first thing I wanted to sort of repeat, even from our last webinar, because I think it's relatively underestimated and underappreciated, but also something that affects all of us, not just sleeping and working adults, but also our kids. And I'm going to reference a little more about our kids as well, having been a former or still a pediatric sleep expert of sorts. That really sleep duration as a measurement, and it's only a single measurement, of course. It's not about quality of sleep, it's about quantity, is well known to change over the course of your life. And when you get into those adult years, you really should be sleeping in that 7 to 9 hour range. And all the studies that support that information actually show that if you're sleeping less than that 7 to 9 hour range, you're really increasing your chances for all problems related to mortality, as well as things like cardiovascular disease and even accidents. And then there are a number of other risk factors that go along with sleeping too little compared to most average American adults. Unfortunately, the average American adult doesn't get all that much sleep, which is one of the problems that we're going to talk about today. And this is also something I wanted to bring forward from our last webinar to help inculcate the audience, at least with data, so you have information that's at your fingertips that you can use and take back into your own environments to support moving a sleep health agenda forward. And the first is from the CDC Healthy People 2020, and everybody knows the Centers for Disease Control and Prevention here in Atlanta, Georgia. But what they may not know is that along with tracking things like cardiovascular disease, hypertension, and diabetes across the United States for decades, it also has been looking at what's happening with American sleep. And what we know right now is that currently, if you look at the average American sleep, it's really insufficient. And when we looked at those recommendations earlier, all based on good science, and you look at children, start with children on the left-hand side here. These are one of the targets that the CDC has put out there for 2020. And what they found is that only 30.9% of children in the high school ages, and that's a total there on the left bar, but across 9th, 10th, 11th, and 12th graders, are sleeping less than the number of hours that they need, which is on average around 8 to 10 hours for kids in this age group. But only 30%, 31% are currently sleeping at that level, at enough hours. The target's to get to 33% by 2020, which we may or may not be actually on target for that. But it's a big problem. This is much, much more of a problem than we even have within the adult population, which is on the second graph on the right. And here you can see that currently 69.6% of American adults are sleeping the recommended 7 to 9 hours a night, or at least the 7 hours or above. But the target is around 70.8 or almost 71% over the course of the 2020 target. So getting this information out into the hands of folks who can actually tell the rest of our population that this isn't the right way to sleep. We should be sleeping in the 7 to 9 hour range as adults. And certainly our kids need more sleep, as you can see from these data. This is what we really need to be talking about. One of the things that also is related specifically to companies and employers, specifically self-insured employers, is the cost of healthcare related to those areas of the country where people are not sleeping so well. I think I jumped ahead of there on myself. But this actual data comes from the CDC, and this is the data behind all of that information we were just talking about. They looked across and surveyed the United States for a number of years. We know well about the issues with diabetes, hypertension, obesity, which are the three maps on the right side of the page, with the purple data there on the top as related to obesity. And that's where the obesity epidemic within our country really is, although it's pretty much across the board. It really focuses in the Southeast and the Midwest. The same thing's true in the middle map, which is mainly orange and a little bit of red as well in the lower southeastern states, showing that that's really where we have a big problem with diabetes. And then below is hypertension, and see hypertension overlaps within the same regions as diabetes and obesity. Interestingly, though, in the last 10 years, we've been starting to find data from the CDC about the same counties where they're surveying for all these other chronic diseases related to sleeping adequately. And what they found is in over 1/3 of U.S. adults sleep less than 7 hours a night. Again, that's that 1/3 that's not sleeping enough from the previous data. And where they're located dramatically overlaps with the same problems of chronic disease. And so what we know is that that population that's living in the southeast of the United States in particular, but the Midwest, and as you can see from this map, a little bit spread down into the Texas areas, that is the problem zone currently in terms of chronic disease being created or driven by poor sleep. This is also something that we've studied in our own analysis of actual claims data. Okay, that data we just looked at was actually survey data. This is claims data. So what's actually being spent by employers? And these are self-insured employers all over the country. This is over almost 500,000 people individually within this population, and we studied over the age of 25. And what we found is remarkably, within the same region of the country, sleep-related healthcare, or the cost burden related to poor sleep, is actually driven in the same state. So we're seeing that it's about sleep as a predrome to these long-term chronic diseases, and at the same time, in real claims data, the data that we actually use to see what the cost of care is, it's being driven in the same state. So people with poor sleep living in these same states and employed by employers in these states are actually driving up the highest cost within their companies related to their poor sleep. This is really interesting because when you look back into some of the data about some of the research related to sleep in workplaces and the kind of sleep-related effects of when you go to work sleepy or when you work on a schedule that leaves you sleepy, there's a lot of interesting overlap. And there's a lot of information now coming out of studies like this one, which was actually conducted just last year, a 6-month survey on Facebook ads targeted at the 15 largest retailers in the United States. And they found that they looked at a couple of things in particular. One is work schedules. So they asked people in this survey, if you work on a schedule, is it a regular day schedule, an evening schedule, is it a regular night schedule, or you have a variable schedule, and or do you rotate schedules? And the other thing they asked was, if you do have a schedule like this, what is your shift change notification if you vary or rotate your shifts? Do they give you less than a week, 1 to 2 weeks schedule notice, 2 to 3, 3 to 4, or greater than 4? And so that was really the work here, and it was done by a number of really reputable, great places, the School of Public Health at Berkeley, the Washington Center for Equitable Growth, as well as some really good groups that do public health out in California and the West Coast. And what they found, and this is just one of the outcomes from the study, which I thought was interesting and wanted to share with you, is that the amount of serious psychological distress that was noted by the population in this study was specifically around people on the types of work schedules that are variable, which you see there in the middle graph circled in green, as well as rotating over to the right side of that same graph, but also people who are on a regular night schedule, which really comes down to mean one thing, that when we work in a variable environment or we put ourselves to work at night, which is typically against our circadian rhythm, we increase the serious psychological distress that we notice in our lives. And this study, this is only one outcome. It also demonstrated that it wasn't only psychological, but it impacted daytime performance. It impacted a lot of outcomes related to workplace and stress. So why is this happening? So what happens when somebody is sleep deprived? Well, we know there are specific deficits that occur within the cognitive domain, and we talked a bit about this last week or last month in terms of executive dysfunction. But let's talk about these really quickly so you have a sense of it. One is determining the scope of a problem and the inability to remember the temporal order of information, and also to focus on things that are relevant. So you can be distracted very easily when you're sleep deprived from your actual work. Being flexible in your ability to think through creatively and problem solve. And then also we know from a lot of good neuroscience, which we also covered last month, that people who are sleep deprived take much more risk and have less insight into that risk, and they overestimate the benefit of their risk, which can be awfully bad, especially if you happen to be putting money down at a gambling place like Las Vegas, as we talked about too. Inhibiting your impulses is another major problem, which is not just about impulse control related to thoughts or decisions, but also emotional impulses. And then perseveration of things that you don't want to perseverate on. So keeping yourself focused on target and continuing through your day is really one of the main things that sleep helps with. And then modifying your behavior to the changes in your environment are well known to be associated with adequate sleep, but people with sleep deprivation showed significant impairments. So that neuroscience of sleep that we talked about last month, was really related to something specific that we called executive function. And the one thing about executive function that we know, it's not about being an executive, it's the executor of your central nervous system, that part of your frontal lobe that we all have that keeps us on track. And that's a neuroscientific term called executive function. And it's your ability to plan and coordinate, just like it says here, in the face of alteration. So things that come in and out of your environment don't keep you from continuing along your path of thought. And also your ability to monitor and update as needed so that you can just basically distract yourself, keep yourself from being distracted and continue on with your focused attention on the task at hand. So that's one of the main things that sleep actually really helps you to maintain. And something we also covered last month as well was what happens when people are sleep deprived. Well, the first thing that happens is they have a difficulty in executive function. The areas of their frontal lobes, here shown in the image to the right-hand side with the brain that has sort of that orangey color, that's the activity level within the brain depicted with color. That's significantly impaired when somebody is sleep deprived. And it selectively impairs your ability to maintain your memory and to maintain that perseveration of continuing along a line of thought, which is the idea of executive function. So the other thing we talked about, which is important to know, is that when you're awake, not just sleep deprived, but when you're awake beyond 15.8 hours, this is shown through some elegant work at the University of Pennsylvania by Hans van Dagen and Dave Dinges, that when you do this, you're actually accumulating executive dysfunction. And one of the things that we also know is that when you're sleeping below that 8-hour line, which is the alternative or the negative image of the 15.8 hours awake, you're also accumulating executive dysfunction. So think about it in two realms. One is, if I'm staying awake too long, I'm not going to be functioning with what I call my A team in my brain. It's not functioning well. My executive dysfunction starts to get worse and worse. And if I sleep below 8 hours, the concept is also that I'm going to be accumulating executive dysfunction. And what does that do at work? Well, this is a really good question. It's been studied by a number of groups. One is it shows that your ability to lead, in particular, the leadership-associated behaviors, like being results-oriented, solving problems creatively, seeking others' opinions and perspectives, as well as supporting others around you that require emotional and socio-emotional processing. All of those skills are impacted and impaired. And even if you can still perform them in a sleep-deprived state, you're nowhere near as good as you would have been if you had had a good night's sleep and not accumulated this debt. So some of the things I wanted to put as a backdrop to our discussion today, because Nancy's worked in a lot of different industries and a lot of different corporations, is what's the background, the research that shows that sleep loss as a relationship to work-related behaviors. Well, there's studies from medical industries, transportation, manufacturing, municipalities, military, and multiple office-based scenario programs. And this is one that came from a big study. It's a cross-sectional and longitudinal study in the Norwegian National Institute of Occupational Health study. And they looked at multiple companies in multiple industries, thousands and thousands of individuals, and they made a characteristic relationship between poor sleep and multiple work factors. And these are both psychological and social factors that predict your ability to work within your work environment. And what they found is when they took a look at the association with sleep loss or difficulty initiating sleep or disturbed sleep with work behaviors. On this slide, I'll just tell you really quickly what it means. All of those little asterisks across your entire population of psychological and social work factors listed on the left-hand side, all of them were significantly impacted in the cross-sectional analyses as well as in prospective analyses, so in longitudinal outcomes. So it's not just one thing that's impacted, it's all of the functions of the brain and all of the functions that we call social or emotional or psychological, as well as the task and focused memory systems of the brain. They're all impacted when you're sleep deprived. So how do you quantify this, and has anybody quantified this in terms of actual loss of function at work? And there are a few studies. This is one from 2010. Mark Rothstein and a group looked at the cost of poor sleep within the workplace in terms of productivity loss and the associated costs. And what they showed here in their study, which I think was about 4,200 people over 4 different companies represented from transportation to manufacturing and healthcare, is that the percent of work time with performance limitation was actually predicted by people who had either insomnia, which is in the open white bars, or somebody with a problem maintaining sufficient sleep, what's called insufficient sleep syndrome, or ISS, in the gray bar. And they compared those groups in particular to people who were thought to be at risk for sleep disorders but didn't really have a sleep problem at the moment, and those with good sleep. And they assessed all of those folks by surveys that were clinically validated. And then they looked at the work health questionnaire, which helped to understand exactly what the impact was at work and in terms of their productivity time, and then used actual dollar figures to calculate a loss of productivity and a loss of money per employee. And what you see here in the first graph on the left in figure 1 was specifically the changes in the percent of time that people had to take to do things at work. One was time management, and you see a significant difference between people with insomnia and sleep insufficiency compared to the other groups. And that was the same story when you look at mental interpersonal demands, output demands, so trying to get more done, and physical job demands. In all aspects, individuals with insomnia or insufficient sleep took much, much more time compared to their colleagues. And the other aspect that was also looked at was the impairment, percent impairment of those respondents, specifically for different aspects of their function. One, attention, decision making, and memory and motivation. And again, in all cases, the insomnia group in particular, even more so than the sleep insufficiency group, was significantly impaired in attention, decision making, memory, and motivation. And this translated directly into financial terms. What they could say was, based on the sleep loss and the work loss, there's a financial loss per person that they could actually estimate. And in the insomnia group in particular, the mean cost per employee of that lost productivity was estimated at $3,156 per person per year. And the other group that was also somewhat affected, which was the sleep insufficiency group, also had a significant increase to $2,796 worth of productivity loss as well. And you can see this effect down to the at-risk versus the good sleep. The good sleep group, just $1,293 on average. So there is a titration effect. The more your sleep is disturbed, insomnia being the worst in this group, you increase the cost of productivity loss within the population. So this is just one study. There have been a number of others that demonstrate this. And I want to also just touch on one other aspect that's going to affect those, especially that have safety critical roles within their companies, and that is that the safety related activities, and this is actually related to traffic accidents, are specifically related to sleep time and the amount of sleep that people get. So this is a study that looks at when people shift forward in their spring shift forward and when they fall back in the fall because of daylight savings. And this data has been repeated by a number of different studies and showing the same thing, which is in the days, the Monday following the weekend, where you shift forward and you spring forward, in other words, lose an hour of sleep, the accident rates go up dramatically. And this is just the opposite of what you see in fall. When you get people falling back and they get an extra hour of sleep, the Monday following that weekend, there's a significant reduction in accidents. So safety is something that we also have to consider when it comes to sleep and sleep time within a population. One thing we all know from the basic science of circadian biology is that the time of day in which you're doing things also relates to safety. So what I mentioned earlier was those folks that were studied by the group out in California, looking at the shift time and the amount of psychological distress in those that had a regular night shift was just as the same as if you had a rotating shift or a variable shift. Well, this is one of the reasons why, because our circadian system is set up to actually create wakefulness during the daytime, and that's when most of us are acting. So when you look at accidents during the day, and this is traffic accidents again, looking from the National Transportation Safety Board, this is a study in the late 90s, it shows that actually the number of crashes in the daytime are quite low. The biggest crash rate is in the night, and this is when our shift workers are working at night and increasing the opportunity for safety-related accidents. So optimizing sleep in the circadian sense is also something we should be looking at in the workplace. One last slide before I jump into our last section and we start talking to Nancy, is that sleep itself and sleeplessness itself has been equivocated to intoxication. This study has been duplicated as well by others, and it shows the same outcome, that basically when you keep people awake, when they get beyond that 15 hours of being awake, just as we said earlier, they start to perform as if they have a blood alcohol level of 0.05. And as that increases in terms of hours awake, it's as if they're actually at a 0.08 or 0.1 level when they get to that 17 to 19 hour level. And so this is something that's really important to think about, because if you equivocate it in your own mind, you wouldn't let somebody come to work with a blood alcohol level of 0.05 or 0.1. But if people have been awake and continuously not sleeping well, it's as if they're coming to work with this same problem, because their functional outcome, their driving ability, their ability to perform is that bad. And it's equivalent to being intoxicated with alcohol. So just a way to kind of make this a little bit of a level set, because we all know how bad it is to come to do something in a state where you're impaired, but we don't often think of sleeplessness or insomnia as impairment. And actually it is. It's an impairment just like alcohol is. So what happens when a company addresses sleep loss? This is a great question, because there's a lot of work out there that's showing the effect of the population that has sleep problems, but when you correct it, what happens is you improve specific areas of judgment, decision-making, and emotional intelligence right off the bat. So remember we talked about how the brain is impacted by sleep loss? Well, this is what happens when the brain becomes re-engaged. You get significant changes in judgment, decision-making, and emotional intelligence. These studies here show the compromise in moral judgment, that there's significant response time reductions in people with sleep deprivation, and emotional insight gets significant improvement with healthy sleep. So all of these folks that were impacted and had 2.9 times as many workplace accidents are now reducing their workplace accidents by at least that much. And in fact, in our work has shown it is far more than 2.9 times. Also, we know that people who are sleep deprived have a lot more absences from work. And again, looking at that U-shaped curve of sleep time, when people sleep in that 7 to 9 hour picture, which you see over in the right-hand picture here, you see a reduction in the risk of showing up sick or absent from work. And then also what we know is that when you look at the costs of people who are having sleep issues in the population, and this is a claims-based data study that was done by Mullman and the group at IBI, Integrated Benefits Institute, they found that actually there's a significant savings to be had for people related to absenteeism and presenteeism in particular, for people with sleep disorders. And what they showed in their data was that 46% of the savings associated with treating sleep problems was only on the medical and pharmacy. The other side, the larger half of the savings, was due to the effect on presenteeism, absenteeism, and wage replacement. So big changes that can occur within a population associated with producing better sleepers. In the work that we've done with employers, what we have found over the course of multi-year studies within populations of hundreds of folks with sleep disorders being treated is that those people being treated for their sleep disorders have a reduction in their healthcare costs. They have those reductions in the first year, 22.8%, but it continues year to year to year. So they continuously save around 22 to 23% year on year because their sleep is improved. And they save those costs across the board in other areas associated with healthcare, associated with cardiovascular disease, diabetes, hypertension, metabolic syndrome, and even things like depression and anxiety, which are driven by sleep disorders. The other side of the story is that we also can see significant reductions in accidents at work. In populations that we've studied the same groups over the course of 12 and 24 months, we see 69% and 75% less accidents. When we compare them, just like with this the healthcare dollar studies, we compare them to like individuals within their populations, what we so-called a matched cohort. And so we've taken away a lot of the confounders that could account for these things in other ways, and all we're left with is that they're better sleepers than they were before, and compared to their cohort, they're much better off than they were before. So this is what's happening. This is what's happening in the work-life balance, which I guess you can call it a new millennial business metric, because there is a new life balance that's being struck in the workplace. The sleep deficits that are killing performance and causing organizational costs are starting to be recognized. And now even groups like the Harvard Business Review are publishing about the proven link between effective leadership and getting enough sleep, and the deficit that's created by sleep, and how it reduces performance. And again, there are others like the Arianna Huffington book about the sleep revolution has a lot of good data in there. The McKinsey report that Harvard and McKinsey did together looking at the organizational cost of insufficient sleep that we can certainly reference for you. So there's a lot of data. There's a lot of information. And there's also a few of us in the area that talk about this, and one of them is with us today, and that's Nancy Rothstein, as she was introduced earlier as the sleep ambassador. But that certainly is a moniker that she's earned over the course of time, and maybe she can tell us a little bit more about where she got that name, the Sleep Ambassador. So welcome, Nancy. We're glad to have you with us today.
Hi, as they call you, Dr. D. A pleasure to be here. It's great, and you're right. There are few of us, but this problem is so monumental. As I'm listening to you, I'm thinking to myself, all of this science, all of this, and a great coverage of the science, which you always do. But what really captivates and compels me is that we need all this proof to say something that in many ways is becoming more and more obvious. Our behaviors have changed, our biology hasn't. And insufficient sleep, be it quality or quantity, is just not sustainable. And we're here, and all of you listening are associated with corporations. Many of you are in HR directors and safety directors, and we're all starting to realize that's why you're all here today, that we have a problem. And the CDC, whether it's an epidemic or they call it a crisis, is that insufficient sleep is not sustainable, and that's why we're here today. You did ask though. I started my quest in all of this because I had a snoring spouse. And I wrote my daddy's snores. Yeah, I wrote my daddy's snores literally originally on a piece of construction paper while trying to help and dozing off in my daughter's kindergarten room, and that was a long time ago. But what it said to me when that came out from Scholastic, I was already recognizing that sleep was a significant issue. And long story short, my career in financial risk management, which had spanned decades, and my first book was on hedging interest rate risk, was saying, wait a minute, sleep is a risk management issue in the corporate world, and we need to do something about it. And so here I am, talking with you today with this wonderful audience of interested people. What do we do about this?
Yeah, well, actually, I have a question for you then. And given that you know how to hedge risk, what do you think, based on what you've perceived as working within different corporations and different industries and environments, what is sort of a common urgent need in terms of what's the most troubling problems that you're seeing at companies that are related to sleep?
So it's so interesting you say that. I think what's happened, and it took the passage of time to have this kind of impact, and that is that people are starting, both from the management perspective and employees are saying, wait a minute, this paradigm isn't working. I can't work, I just was consulting to an investment bank, and you had junior analysts who were working till 2 in the morning, and then their bosses, management, are texting them at 6 in the morning. So there's a culture there of this nonstop 24/7, and they don't have to be, texting from Singapore. It can be right here in the USA. Right. And there's got to be some kind of a paradigm shift in corporate culture. Right. Some kind of a zone where you might text or email people, but your expectation is not that they're going to answer in 6 seconds. Right. So I think one of the most urgent and troubling problems is also one of our biggest benefits and the great things is technology. And we're also wired and tired. I think there was a book in that title at some point.
Yeah, I think you're right.
I think what's starting to happen is that management is recognizing this, as pun intended. They're waking up to the importance of sleep. And employees, and surprisingly, I've worked, and they're happy about my saying it, with LinkedIn, which is a pretty millennial audience. And we had sleep fairs in New York. Their headquarters is in Sunnyvale, California, but in New York and in their European headquarters in Dublin. And the participation was, well over a third in each of those offices attending a 4-hour sleep fair, because millennials are saying, I can't keep this up. And so we have to, what do we do about it? But your question is that the troubling problem is that we can't keep up this pace.
Yeah, no, you're absolutely right. I think that we've all recognized that for ourselves individually when we're not sleeping well, that it's really hard to maintain your regular pace. But you can imagine what that might be at a company level or at a population level. And so, that the idea that the millennial generation, which is now the largest part of our workforce, just surpassing the Gen Xers, like myself, have really taken on a different, I guess, a different view of work and a different view of work-life balance compared to previous generations in some way. And I wonder, thinking about approaching companies with a value proposition of what's affecting their workforce in terms of how sleep might be one of those components, do you think that there is perhaps a difference, a different way of approaching millennials versus the rest of us, or is it really pretty much the same, or what are you seeing from your perspective in terms of the proposition, like the value of sleep?
Well, it's so interesting you say that. One thing is true, no matter whether you have no high school degree or 2 PhDs, the chances are you've never had a course on sleep. So we have to step back, and most people don't know what happens during a third of their life. The science is fascinating. There's a great TED Med talk, One More Reason to Get a Good Night's Sleep, with research about what happens to our brain and how it cleanses itself during sleep. This is relatively new research. Someone sees that, they read the McKinsey report as a leader or as an employee, they start to look at the research that's provided on fusion, and they start to say, wait a minute, there's a lot happening. This is not I like to say we're cities that never sleep, but that doesn't mean you shouldn't, and it also connects to a really important point, which is sort of the dilemma of the employer, whether they're addressing millennials or baby boomers or Gen Xers or anybody else. And that is that you can't mandate how an employee sleeps.
Right.
And nobody can sleep for you but you. You can't outsource a person's sleep, nor can the person outsource their sleep, much as many of us might like to. So in the end of the day, and I guess that wasn't intended, but you have to say, what can I provide and how am I going to reach my employees to take sleep seriously? First, it's a culture shift. Second, there may be policy issues about when you can email, when you can't, vacation, whatever. But I think you also have to say, how am I going to reach this audience? And believe me, myself and my colleagues at Circadian spend a lot of time considering that and being very customized to our clients about how are we going to reach their audience. What's going to be compelling to them about how they address, sleep education and sleep training or strategies.
Yeah, and you bring up the employer's role. I think that's maybe it's a really good area for us to investigate a little bit more and spend more time talking about, because I guess it is very dependent on the industry too. I mean, there are industries that do have regulations around sleep and sleep time, and especially transportation-based industries and safety-critical industries, but there are those that it's really not. And you mentioned things like LinkedIn, and we could talk about maybe the movie Internship, which showed the Google environment where they were sleeping in napping pods. I guess there's an awareness that there's a need for a napping pod, but are we putting napping pods in there to cover up the problem, or are we putting napping pods in because we've integrated a larger understanding of the importance of sleep? So, when you approach these environments, whether it's a regulated population or a non-regulated population, do you see a way for the employers to kind of move into this space in a fashion that doesn't come across as heavy-handed or big brotherish?
Well, you said so much, and that's a heavy loaded question, but I want to first say something about napping pods. I'm so happy you brought that up. I think that they are great, but if a company's providing, and you said, is it just sort of a Band-Aid? And in many ways it is. If you've just got napping pods and you have no sleep education and training, then you're doing a disservice to your workforce, because if you've got really good quality and quantity of sleep, you shouldn't really need a nap. And if you need a power nap, I mean, should there be a new paradigm where you see them with their eyes closed at their desk, you just respect it as they're taking a power nap? Because first of all, the people in a napping pod, I guess if you're pregnant, if you're sick, you shouldn't probably be at work. And if you're tired from jet lag, then I know an investment bank that did that, and that's great. But napping pods alone are not the answer. It's got to be broader than that. And you raised another great point. Having worked with a major global company and their shift workers, and look, Circadian's been in the business of working with 24/7 shift work populations for over 30 years. I started with them and partnered to create a corporate sleep division. And the reason I mention it is, why did this need for corporate sleep? Because we had to address people who work, and I say in quotes, normal hours. Who
Right.
works normal hours anymore? But it in the end, everybody needs a good night's sleep, no matter what hour. I mean, a shift worker who's got great sleep hygiene, sleep habits, and a great sleep routine and respects it may be doing better health-wise than somebody who works supposed normal hours and has horrible sleep habits. They're on technology in bed, and they're having alcohol before bed and caffeine late in the day. So, it's so individualized. But if we can have a construct through which we can respect a company's needs and the needs of their workforce, we're going to really be able to address this better. And I don't think they have to be heavy-handed. I can't believe how receptive. In fact, one of the probably most important testimonials I ever got was a rapidly rotating shift worker who said the most important part of the intervention, of the sleep intervention for them, was to know that the company cared.
Yeah. We've heard the same in our programs too, and even with the regulated population of transportation workers,
right,
where there's a certain amount of suspicion, what does the government have my sleep time for? That population also, once they get into a regular habit and they get their sleep issues addressed, it's a remarkable change of mood and attitude, and all of a sudden they're evangelists, just like Jesse.
Yeah.
So it's a common thing. I've got a little time left here, Nancy, and I've got some questions from the audience. Maybe you can field a few for me, okay?
Sure.
All right, I'm gonna boot one out to you on shortstop. Here's the first one. Are there any types of jobs that contribute to poor sleep?
So, of course, there's jobs that contribute to poor sleep. If you are a shift worker, and especially if you're a rotating shift worker, so sometimes you're working nights, sometimes days, that can contribute to poor sleep. And so what do you do about it? Well, you really have to be all the more vigilant about your sleep habits and how you prepare for sleep. And that I think is so important, regardless of when you're sleeping, day or night. You need to have a very good sleep routine in that hour before bed. And as I like to say, and Ariana Huffington loves, is recharge your devices out of the bedroom so you can recharge in bed. And that is just so important. I know it's so hard for us to disconnect from our devices, but again, our biology, for all kinds of reasons, with melatonin and exposure to blue light, et cetera, not to mention the stimulation, it's just craving for us to transition to sleep. Like I prepared for this webinar, you all prepare for a meeting, you prepare to exercise, to go on a trip, you got to prepare for sleep.
Yep, absolutely, a great point, and that's something I think that you touched on in the very beginning, is that our culture shift, and I think some of the data from the CDC bears this out too, that as a culture, we're not really protecting our sleep, and that's something that not only is it us as adults who are not protecting our sleep, but we really can tell what's happening when you look at what's happening to our kids' sleep. If we're not protecting our kids' sleep, who is? And fully 2/3 of kids in high school are not sleeping enough. And I know I have 4, and they're not. They don't sleep enough. And they live in the sleep expert's household here. But that's only because we allow it. And so there is something within our cultural norm that it will, I think, have to shift in time for us to maintain our health and well-being. Well, I got another question for you. This is another one from the audience. What are the biggest issues in the workplace caused by poor sleep?
Well, I would say the biggest issues in the workplace caused by poor sleep are lack of good judgment, decision making, the inability to work as a team because you may be moody and irritable because you're not rested. Safety is a huge issue because if you are sleep deprived, you're more at risk for falling asleep at the wheel, not to mention if you work in a factory, making some kind of an error there. Another big issue is your health, which will be reflected in terms of your health and how you work, how you function at work, but it's also going to impact, and Dr. D in Fusion Health certainly know a lot about its impact on healthcare costs. So,
Right.
and I will just add as a caveat there, everybody, you can have the world's best sleep habits, but if you have an undiagnosed and untreated sleep disorder, such as sleep apnea, restless leg, narcolepsy, or true insomnia, then, you can't, all the good sleep habits in the world will be compromised.
Right,
So
right.
important.
Yep, great point. That's a great point, Nancy. Something that often gets mixed discussion points. But yeah, I think I completely agree with you from the perspective of what we've seen in the workplace as well. So got a little more time here. Got another question here. Sleep is supposedly a third of someone's life. So why are sleep issues just getting attention now? There's a good
That
thought.
is such a terrific question. And think of this one. Over the next 10 years of your life, about 3 will be spent sleeping. And the quality of those 3 sleeping years is going to directly impact the other 7. But why now? Well, the real research on sleep didn't really start till the 50s and 60s. That was when, the term REM for rapid eye movement came about. But I think what it took, and the research that Dr. D just shared with us showed that it's only recently that, and that's what I said was so captivating and compelling, is that it's all this research that is pointing out to management that this is what's happening because your workforce is sleep deprived. And by the way, that third, the 60% that are sleeping 7 hours or more, as you mentioned, I sit on the NIH's Sleep Disorders Research Advisory Board, and the NIH is all about public health. So we talk about sleep as a major public health issue. And I think that number, I don't know if it's where, I know the data comes from the CDC and other sources, but I question how, if it's not much worse than that. So
I totally agree with you. I think that's just a quantity number, not a quality number for sure.
Yeah, and I think that, self-reported this, that, and the other thing. But back to the question, why is this just getting so much attention? Because it took research and data to point out to people, and it also took time. How long have we actually been on our cell phones and all these devices? I mean, I'm not in bed, but many of us are. And how long has that been going on? So it took time to pass for the fact that this isn't sustainable the way we're living, for people to suddenly say, I can't do this anymore. But the good news is it's doable. It's about shifting some habits. It's about recognizing, it's about educating yourself or asking your company to provide sleep education and training. Actually, can I add one thing to that I think for this audience is so important? The figures are in the billions of what we spend in the US alone on training and development. And for people in HR who spend a lot of time thinking of skill sets of people they hire at all levels, just consider this. When someone is sleep deprived, either coming in there or they've worked there, but anybody who is sleep deprived, all that T&D and all of those skill sets are compromised. So if you engage in sleep education and training as part of your overall, not just onboarding, but in general, you're going to enhance the rewards from all of the training and development that you're doing.
Absolutely. And I think that's actually where companies are starting to make the shift. You're absolutely right. They're putting their money where their mouth is in some cases and actually improving the sleep just by getting it known within their population that sleep is something that we talk about. And when you start talking about it, you start to change the behavior, because it's cognitive behavioral therapy, right? You start with the thoughts, change the way people think, and the behaviors follow. Yeah, absolutely. Well, we have time for one more question here, Nancy, so I'm going to throw one out that's a little more specific. So a couple of folks have been asking in the audience, what is your best advice for working third shift? Do you have any good advice for those that are working a third shift and against their circadian nature?
So, and by third shift, I think they're saying, I don't know if that's called the graveyard shift or the one that's, really, really overnight.
The worst
from
shift.
Like 12 till 8.
Yeah.
I think the first thing to do is, and if it's consistent, is first you have to really honor your sleep when you get it. And that means if you're sleeping during the day, you need it to be really dark and cool and quiet. And that can be a challenge. So is it blackout curtains? Is it an eye shade? Is it a white noise machine? Is it the family or neighbors understanding that this time is really critical to you? The other thing to do is to talk to your employer about, are they doing everything in your environment? And this isn't a sales pitch for circadian lights, but circadian has come out with safe light at night. And we know through the research, the nurses' studies and others, that exposure to bright light at night is not healthy for people working all night because of the impact it has on your circadian rhythm and the impact it has on various aspects of your health. So one of the things is to talk to your employer, and having worked with people who do work that shift, it's so important for them to be aware of what they can do to best serve themselves in the situation they're in. And that involves both employer and a collaboration between employer and employee. But again, your sleep habits, whether you're sleeping day or night, are just critical, and you need to be all the more conscious. And that also includes your fitness, your nutrition. Are you better off, instead of grabbing a Red Bull at 3 or 4 in the morning, or having a piece of cake, are you better off having a walk through the plant or wherever, and doing something, having some chamomile tea, and ask if you can have napping pods or something, or napping rooms where you can take power naps.
Yep, no, that's some great advice, Nancy. And having been in the sleep medicine and circadian neurobiology world myself for over 20, 25 years now, and having the opportunity to work with a 24/7 operation, because our sleep laboratories and our sleep technologists work every night and study those folks with sleep issues. It's been a real discussion between us daytime workers and our colleagues at night to understand what we can do to affect their shift. And I completely agree with you in terms of the collaboration and really working towards understanding. I remember putting in lights in the University of Pennsylvania and Emory Sleep Labs that increase blue wavelengths, so they get a little bit more stimulation while they're at work, which tend to help them with the sleepiness they effectively have during the night.
Right.
But also policies that we didn't have people that would shift backwards; they'd only shift forward. So optimizing shifts when we were residents was something that was very important to just your performance and your outcomes, and then getting the sleep time that you needed. Yeah, all great advice. And I think that one thing I think we can all take away from this is that working in the middle of the night is not always a good thing for us. But if you can optimize your sleep and also optimize your work time so that you can make it as normalized as possible, it will eventually help you to manage through a difficult shift. So
right. And you
yeah.
know what? And here's the thing: listen to your body. Your body is always honest. It tells you what it needs. Your brain's usually in the past or the future. And we could get into mindfulness and meditation and all that great stuff, and I've been meditating for decades, but I will tell you, listen to your body. It's going to tell you what it needs.